My name is Darshini Mahadevia. I'm a professor at School of Arts and Sciences, Ahmedabad University. My background is studying cities and looking at various dimensions of cities development. As I read the stories about Dharavi, what was done in Dharavi is that Mumbai Municipal Corporation focused strongly on Dharavi. They went door to door and identified infected people. They created a quarantine facility where people could be moved out of Dharavi, the quarantine facility away from Dharavi, so that the further infection spread could be controlled. Today, it is said that Dharavi is a big success story about how the COVID-19 spread was controlled in a locality which is 10 million population over 2 square meter, and it's the highest density in the world area where this was controlled. Whereas in Ahmedabad, this was not possible, or it's not been done. Ahmedabad could have acted very quickly and shifted people who were infected into a facility outside, but that did not happen. And so by mid-May, it was realized that we don't have facilities, and so government decided to open up the private healthcare system, that is private hospitals. So when the private healthcare systems were opened up for COVID treatment, initially there was resistance from the private hospitals to open it up for COVID patients. But when they were forced by the government, state government to open it up, a hearsay tells us that the cost of treatment in these hospitals is extremely high, and which is not really possible for any middle class or lower middle class person to bear. Instead, instead of bringing everybody to the hospital, could have been other facilities created outside the public health system where people with milder symptoms could have been quarantined and treated. And those with very severe conditions or people who were elderly could have been brought to the hospital. But instead of that, everybody was brought to the hospital, and eventually the city ran out of the facilities.